Bill Gates spoke about Ebola Monday in Washington. He was interviewed as part of Politico's Lessons from Leaders series. This is an hour.
Mike, thank you so much, and Anne, a special thanks to you. We're delighted to be partnering with Bank of America and to kick off this series. I can't think of anyone better or more timely to have a conversation with than Bill Gates. We so appreciate you joining us this morning, and to all of you who are here. We're going to start off with it in a way an unlikely, but I think absolutely fitting topic, which is the subject of Ebola and the spreading crisis in Africa and potentially beyond Africa. The Gates Foundation recently announced that it is donating $50 million to help with the response. I think all of us think about what's happening with the disease and the spread of it, and we have to ask questions that really relate to leadership, right? Whether it's our global health institutions, whether it's individual countries and their ability or lack thereof to respond to it, whether the United States has a role, and whether it was too late and slow in mobilizing and thinking about the kind of leadership that would be required. So, Mr. Gates, obviously you've spent the last really more than a decade focused on global health challenges in Africa. Here comes a big crisis of exactly the sort that we've been worrying about and warning about. Where do you feel the role of individual leadership and global leadership comes into play in this crisis?
Well, I think Ebola is a great example of where the world really needs to come together. The three countries where this outbreak took place have had a lot of civil war, very weak health systems. Ebola had never shown up in West Africa before. And so it did take a while for people to understand, okay, we've got Ebola here. And even that eventually what we saw was a very unique Ebola epidemic. There have been over a dozen, and they've all been, you could say, like bushfires that with the right, a little bit of pressure, getting some medical workers in, getting people to not intermingle both with the people who have it while they're living or as they're burying the people who die from it. And yet here it got into a big city, and it is an incredible challenge, and everybody's now putting their resources in. Tom Frieden went over there personally, went and saw it, the head of the CDC, and he's the one who really said, no, this is a different Ebola epidemic. And now everybody's galvanizing to get behind this. I think it is quite impressive what's being pulled together. And I do think we'll be able to get this under control. We need to make sure that it doesn't spread out to other parts of Africa. That's a particular challenge, and then we need to get it under control in these three locations. And there's a pretty clear roadmap of what needs to be done. Our foundation's particularly involved in a few of the locations, like in Nigeria, because there's been a big investment in polio eradication. And the whole idea of having expertise in what are called emergency operations centers and how you orchestrate medical personnel, the polio resources and the polio lessons are very helpful here. In fact, the reason that it got stopped in two of the countries, Nigeria and Senegal, is because people from polio were pulled in, acted very quickly. Money from us and others was pulled in. So the next few months will be tense. Every day, there's tons of email flying about how quickly can people get in, can we get the new tools. But there's an overall approach now, and the U.S. is, as usual on world problems, stepping up. Both in terms of the science, the understanding, and now the U.S. military's logistic ability to get supplies in and create field hospitals that are critical.
Mr. Gates, what an honor to have you here, and we had you great conversation last year at Bank of America's Playbook Cocktails. I'm sorry there's no booze this time, but you say that...
It is 8 in the morning.
It's 5 o'clock somewhere. You say that we're mobilizing now and we're going to get this under control, but David Nather has a great story up, the lead story of Politico this morning, the Ebola leadership gap, that points out how late everyone has been. The private sector, governments, why did it get so far out of control?
Well, I suppose that's the easiest article to write, is when there's a financial crisis or a... Well, unless you have an algorithm for predicting the future, all new surprising things, that article is great. I'm pretty impressed with how quickly people have stepped up on this. Ideally, you would have decent primary health care in all of Africa. It's far better today throughout Africa because of a variety of things, including PEPFAR money's gone in to build up systems. General US aid has gone in to build up systems. These three countries, partly because of civil war, have not gotten there. And so because Ebola was never seen in this area before, and because the primary health care system didn't report it, and because burial practice, the touching of the body, makes the disease spread far more forceful, it percolated along in the May-June timeframe, and only in July did you have an urban case. Then in August, the numbers started to jump up. And that's when everybody said, okay, this is quite unique. We had done a grant in July. We did one in August. And we got the Nigeria thing organized. But you'd say it was mid to late August before the world saw this as a very unique Ebola crisis.
If you're Joe Moore, why should you care? What does it mean to the U.S. now and in coming years?
Well, the epidemics like this, it's far better to stop them before they spread to lots and lots of countries. And the tragedy here is both the Ebola deaths, but also the civil unrest. What happens when you have people panicking about an epidemic is that the entire health system shuts down. And so more people will die of malaria, pneumonia, diarrhea, not having hospital services for delivery. The death toll from this type of shutdown is because of a huge variety of diseases. And so we should all care a lot that not spread to lots and lots of locations. I mean, if the right thing hadn't been done in Nigeria to catch it in the bud, you'd have there, a city with 10 million people, and you'd have a complete disaster and lots of panic. So I think we should care about the people there and the economies there. And the U.S., in fact, is the one who's got the CDC that can figure these things out, playing a central role. It's got the Army that can go in there with the logistics and the medical understanding. All the new tools we're looking at in terms of vaccines and diagnostics, it's all stuff that the primary funder in general and of the particular things that look like they can be pulled together pretty quickly are all U.S. investment in innovation type things. So for me, this is one of the great causes, one of the two causes our foundation has picked is the health of everybody in the world, treating lives as having equal value, making sure that not only do you get rid of the death, but kids can grow up in a healthy way. To us, it's a very central thing. But the key actor is the United States and the investments that, in a bipartisan way, this country has stood behind for literally decades.
Can I ask you about institutions? You talked about the infrastructure that already existed on polio, thanks in part to the work that you've done, being able to swing over when there's a crisis and to respond. Obviously, not all of these countries have that infrastructure. How much, when you look at a crisis like this, do you see it as being one where you have to, in effect, pre-position your success? You need infrastructure, you need institutions that function versus politics. Where do politics come into play, both in successfully dealing with something like this or not, as the case may be?
Well, we'd like every country to be self-sufficient so that both in terms of running a good primary healthcare system and funding a good primary healthcare system, it's all okay. And they just participate in regional bodies that have standby capacity to deal with these things. Africa, of all the places in the world, is the furthest behind on being able to do that. And through aid, health and health systems in Africa have improved very, very dramatically. I mean, childhood death is down by over half in Africa as a whole between the year 2000 and now. And there's been an acceleration. The Economist just had a good piece on this, on the acceleration over the last 5 years as people got more focused on this as one of those measurable Millennium Development Goals. And, I think there's probably about 20 years here where there'll be some countries in Africa that we need to help lift them up. The ongoing rate of bad health there is very high. Over 500,000 kids a year die of malaria. Ebola isn't going to get to the level of something like a malaria or an HIV, because I do think we're stepping up and will respond. Those things, through medical research, through generosity like PEPFAR, those things will also come under control. And that's how you'll be able to move all these African countries up to middle income status. It won't happen overnight, but we can see slowly but surely Africa's no longer as much of an outlier as it was in the past.
Now, this is your first interview on Ebola since the outbreak, but you've been engaging Washington on global health for years, and people assume Washington's totally broken down, but it's your view that Washington actually has showed some leadership that the press hasn't really covered.
Well, the phenomenal generosity of the United States in its aid budget towards health issues is the best in the world. You can look at that broadly. You can look at it in terms of the HIV, the PEPFAR money, which came together in a Republican administration with bipartisan support. It's been increased under this administration. Fortunately, it's one of the few things that there really is a strong consensus on. Getting vaccines out to these kids, that's the Global Alliance for Vaccines. Helping support polio eradication. There was actually a slight increase, $50 million a year, in the polio budget, which was fantastic. It allowed us to go to other countries and get lots more money and get enough money so that polio eradication can be completed. And whenever we get senators or congressmen to go out to Africa and see what's happened with malaria, that's President's Malaria Initiative, to see what PEPFAR has been able to do with health systems, people come back very proud of the uplifting that's taking place there. And so it has been, there has been consensus, and the money's gone up as people have seen the success. And this is one of those very measurable things. This isn't, oh, they're in tough shape, we'll just shovel money over there and maybe something good will happen. In fact, in this case, you can follow the vaccines and you can follow the polio cases. In the case of Ebola, we won't be able to run the counterfactual of the U.S. not showing up, but I guarantee it would be very, very different. It's, sitting there a few weeks ago saying, will the president invoke all the resources of the U.S., which in fact he did, and I was thrilled at that.
Finally.
No, I wouldn't say finally. Was there some other government who took decisive action before we did? Was the data really clear? Was there somebody whose CDC equivalent flew in and personally toured all these things? Is there someone else whose research is going to give us the vaccine that will be key to making sure this outbreak doesn't happen again? The U.S. is the leader on being able to move into areas like this and help out. We have a lot of other countries that do step up in these things, the UK and France. But unless the U.S., that U.S. military logistic capability, being able to move as quickly as they do, getting people in and out, and being able even to say to medical workers, if you go in here, there will be an evacuation capability. That's why now the recruitment of medical workers worldwide is getting us to the level where we can get people to treatment centers. And that's, if you want to know what's going to help us win or lose on this, if the treatment centers are full and you're saying to people, hey, go back in your community, try not to touch anyone, then the epidemic, then they'll move around, they'll infect lots more people. If the reputation of the treatment centers, that's where you go, there is capacity, it increases your chance of surviving, and if you die, somehow the way your body's dealt with will match with cultural practice. When we get there, this thing will start to drop. We're not there yet, but that U.S. capability, the polio resources that have been there to create the idea of these emergency operations centers. That's why I think we are going to get on top of this.
All right, that is the nicest thing I've heard about Washington in a long time. Susan?
Well, that was going to be my point. So Congress is at a historic low in its approval ratings. We didn't think it could go any lower, but it seems determined to set those kind of records. It's an election year. There might be consensus around certain aspects of global health, but in reality, support for foreign aid, as you know, and your team has thought a lot about how to change that. There's a diminishing zeal on the part of many Americans to remain engaged internationally. You know, how do you fight that? Number one, and number two, are there ways in which you found your goals to be frustrated by the gridlock here in Washington?
Well, the gridlock is very concerning. I think there's a lot of issues, immigration, increasing the energy R&D budget. There are some things that I think should be happening. I don't think our research, our investment in medical research should be allowed to tail off like it has been allowed to. So even in some of these great areas, it's a bit worrying. I don't think the term foreign aid is going to be easy to salvage. If people just think of that term, then all the money that we sent around in the Cold War to back our bad guy, where we didn't really pay any attention, we didn't measure any outcome from after we sent that check to Mobutu, and to see, did he build good palaces and was he having a good time? That's probably irredeemable. So talking about this aid in terms of the particular human things it does, that can be successful. And that's why getting as many Americans, not just politicians, but as many out to see this in action as we can, having them come back and tell the story. That's our best tool, is the truth about the reality of how tough things are and yet how much they're improving. And so, over a quarter of the aid budget is global health related. AIDS, malaria, polio, basic health infrastructures. We're going to try and we're asking that there be a modest increase in the vaccine money out of that budget, as there's a new round of raising money for this Gavi that finances the vaccines for these very poor countries. When you talk to people in those terms, and you talk about literally saving lives for very small amounts of money and getting these countries on a path to self-sufficiency, then you see a strong response. But we have to tell that story, and it's got to compete with other budget priorities.
So we want to involve all of you in this conversation about lessons from leaders. So one of my political colleagues has microphones, so just signal if you have a question. We'll bring you in. Mr. Gates, who are a couple of leaders who you admire, living or dead?
Well, there's leaders in science, people who really figure things out, like Richard Feynman, or people who work on vaccines, tons of people working on HIV vaccine. There's leaders in business, people like Warren Buffett, who've got a certain approach they take that are pretty amazing. There's product innovators like Steve Jobs was, where he gets behind a concept, does a fantastic job. There are people out in the field, whose names we won't know. There are, several hundred people who stayed in the Ebola-affected countries and continued to do the work, put themselves at great risk, because medical workers are the most likely to be infected, because they're helping out when the person's health is deteriorating, including quite a bit of bleeding as they're getting very, very sick. So there's many domains of heroes. I've gotten to work with some people like Warren Buffett, I've sat and talked to, learned from. Nelson Mandela, I got to meet with a few times, talk to him while he was trying to get the AIDS crisis, people to acknowledge it, step up and do the right thing. So, it's pretty amazing, the great scientists or people in the field or leaders that I get to sit and talk with.
So to take Warren Buffett or Nelson Mandela, can you point to specific traits that would help young people who want to be great leaders, great managers, great innovators? Well,
Mandela told people something they didn't expect to hear from him, which is that, revenge and evening the score of how they'd been treated was not in their interest, and that even though in a certain way it was completely unjust, that the country had to move forward. It had to embrace everybody that lived there. It had to figure out how to have an economy that lifted everybody up. And you would not have predicted such a non-violent transition of power. Literally the building that the government works in is the one where the most popular song that the ANC had was how they were going to blow up that building. Well, Mandela worked in the building that he sang about blowing up literally hundreds of times. And, so that's somebody getting you to step back and think, okay, we're all in this together in a way that without his presence, that just wouldn't have happened.
So as much as you've had this focus on institution building, that's what I wanted to ask you, is about this question of where politics comes into play, both in a positive sense, like Mandela, but I'm thinking about your polio campaign and Pakistan in the last few years, and the crisis that comes when politics defeats institutions or even investment in resources, persistence of ideology. What can you do about those challenges to your work?
Well, we definitely run in the polio campaign to a huge number of problems. You've got terrorist groups that have kind of a nihilistic view towards medicine or vaccines that both in Nigeria and Pakistan, they've literally targeted polio vaccinators and gone out and killed them. And so the fact that people continue to volunteer to step out and get those vaccines out there is a truly amazing thing. We think we're very close to finishing on polio. We haven't had any violent events for the last 6 months. We do have unrest. Boko Haram up in Borno in Nigeria is a real problem. The army in Pakistan actually went in and cleared the area where kids weren't being vaccinated. And virtually all the cases in Pakistan, actually, literally the majority of all the cases in the world are in this one part of Pakistan called Waziristan. And so the fact that the army's cleared it actually means we'll have a bump up in cases as those kids move around, but it gives us a chance to get in and have access. So we're optimistic, despite terrorist groups taking this on, which I wouldn't have expected. Why be against polio eradication? It seems wild that you'd pick that as something to be against. But we've had to put up with it, and yet the non-terrorist leaders have been our partners in trying to get the word out.
I think we have a microphone right here, and we have a question right here. And please introduce yourself.
Stella Dawson, Thomson Reuters Foundation. As you say, infrastructure is absolutely critical to getting this disease under control. You've been investing vast amounts of money in disease-specific campaigns. Are you rethinking how you're going to direct your funding in the future in order to help build more primary healthcare systems? And secondly, would you like to hazard a guess of when you think, given the resources that have been thrown at Ebola, it might be realistic to see it under control?
Well, I don't think you'll get anybody to predict a date. It's hard, given that it could spread out to other locations. That's got to be a big concern. So getting all the surrounding countries to be ready so that if a few people show up there are treatment centers, and people know that getting people into those treatment centers is the right thing for the patient and for the community. And so because of that uncertainty, I'm not going to hazard a guess. This month, the basic infrastructure in the 3 countries is going to get in place. The tent camps are going up fairly quickly. People are volunteering. So, it's great to see the energy that the next, 30 days, those pieces will come into place. We do a lot on primary health care. Almost everything we do that we focus on, which is about saving mothers' lives and children's lives, is delivered through primary health care. And so the way that you train primary health care, the way you measure it, the way you compensate for it, that's a deep specialty of our foundation. And when you look at the outliers, usually health and income level are tightly correlated. As you get richer, you get less malnutrition, less of your kids die. There are countries like Ghana that are ahead of that. That is, less kids die by a lot than you'd expect given how poor they are. And there are some, like Nigeria, that are behind that. And so understanding how the good systems are built and bringing that to those other countries, that's been a huge area of focus for us. It's not so much the actual infrastructure, the buildings is not the hard part. It's training the workers, getting the supply chain, both of normal drugs and also the vaccines that require cold chain in. And you know, we can go through country by country and talk about how we're engaged in raising those primary healthcare systems up. And if we'd had that, you know, this epidemic would have been caught a month or two before it actually was.
There's a strain of thought. We have a couple questions over here, so we'll grab one of those.
Yes, Betsy Williams with Seed Global Health. Just building on that point a little bit, I think something that's been lost is the gains that had really been made in these very fragile healthcare systems. And they've just come from a period of rebuilding with great leadership. And so my question is, what investments can we make in parallel to the Ebola response to restore those services and also ensure that the health system that exists after this is stronger and more resilient than the one that was in place?
Well, as I said, right in that region, you have Ghana, and actually it's Accra, where they're setting up the UN Orchestration Center to try and look at this thing. Ghana is a positive outlier in terms of how they run the primary healthcare system. Ethiopia is a positive outlier. Rwanda is a positive outlier. And in fact, the amount of money that goes in to some of the poor systems, like the Nigerian system, is every bit as much as goes into some of the better systems. So understanding how you spend the money, how you track the activity in those systems, we understand that fairly well. If we can stop Ebola when it's just these three countries, you're talking about population, about 22 million people in the three countries. Building back up primary health care in those three countries should be fairly straightforward, and that'll be a very high priority. As I said, more kids, even in those three countries, will die because the health system is shut down than even will die from Ebola. And so if you hesitate even a few months to get it so mothers feel like, yes, I should go and do safe delivery, or I should go and get malaria medicines or antibiotics for pneumonia, that will be very tragic, even though it's not as explosive and therefore not as garnering the same type of attention that the Ebola deaths themselves attract.
I think Senator Dodd has a question.
Well, thank you. First of all, thank Bank of America for doing this. You're a pretty good example of redefining philanthropy. So thank you. So thank you for all you've done in redefining philanthropy. And can't think of a better example than you as an example of a leader that's made a difference in the world. First of all, thank you for your kind compliments about the Congress. You may be the only person in town. But just to add to your point, actually the House of Representatives increased the funding for PEPFAR in their budget. And Bob Corker told me the other day, Senator Corker, that the Senate will likely as well. So those doesn't get much notice, but those are things that are being done in a positive way. In the year 2000, as you pointed out already, the UN Millennium Goals were identified, the 8 identified. And I'm wondering, looking at it from a management standpoint, and again, you sort of addressed this to some degree already, some of them are rather vague in a sense, all very worthwhile goals, but nonetheless, there's some vagueness to them. How do we score success in those areas, and what management techniques can be brought together? 179 nations signed on to that, and there is a tipping point, I think, in the U.S. in terms of what we can actually do and be successful at it. How do we draw other nations into this process beyond the French and the British and the European countries that do so to become much more aggressive and proactive in addressing some of these issues?
Yeah, that's a very timely question, because those goals essentially, although they were put together in the year 2000, they covered sort of the 25-year period. The baseline was 1990. To 2015, and so we had 15 years for the world to really prioritize those activities. And the fact that they were very measurable, I mean, reduced childhood death by 2/3, was absolutely incredible. And many countries met that. The world as a whole will have only reduced it by a little over half, but still, you know, kind of phenomenal that you know, we went from 12 million children under 5 dying a year to, by the time it's done, will be under 6 million a year. And a lot of that's vaccines that were invented and funded by the United States. In September next year, there'll be a new version adopted to cover the period 2015 to 2030. And because these MDGs got a lot of focus, and they really did drive an acceleration. If you look at the reduction in childhood death, it was towards the end that it got the most progress there. The idea of what should these new goals look like, and now because they got visibility, almost everybody's saying, hey, what about my goal? It's not going to be quite as succinct, but at the center of it will be finishing the unfinished development goals. So getting childhood death all the way down below 4 million a year, and then our foundation's commitment is to even go beyond that. If you got it down to 2 million a year, you'd have health equity. That is, the chance of a child dying in a poor country would be less than double the chance of a child dying in a rich country. And so the idea that lives have equal value and those kids can grow up and not be malnourished and contribute, get their countries to be self-sufficient, that would be achieved. So there's an amazing debate taking place about these goals. I do think drawing in the middle-income countries, the Brazil, Mexico, perhaps most notably China, into these causes is very important, and our foundation is engaged in that. So what you should have is you should have more countries contributing and less countries as recipients, and so your leverage would be very high. Now you'll have some very tough countries like Democratic Republic of Congo, Central African Republic, Mali. You get the very toughest, the landlocked African countries, Yemen, Haiti, Afghanistan, will be the ones that will be focused on. But that's the way this works, is that as the coastal African countries, a lot of those will graduate over the next 10 years. Then that next 10 years will be about the very tough cases. But it's a very uplifting story that we have cut childhood death in half. And the Congress has played a role there. These other donors have played a role. And the voters in all these countries don't have a sense of that was generosity. In other words, of all the dollars spent by the US government, the most impactful are these global health dollars. More lives have been saved and improved per dollar by a huge amount, by that part of the budget, than the rest of it. Now, it's not here in the US, so I'm not saying in general we should go put all our money over there. It's one of many, many priorities, but it's one where you get this measurable result.
Thank you, Senator Dodd. There have been a few articles recently arguing that too much of the capital in Silicon Valley, both financial and human, is going into solving problems of young people in Silicon Valley. It's too hard to get a cab. It's too hard to set our thermostat. In your Harvard commencement address, you talked about the importance of our best minds being dedicated to solving our biggest problems. Do you worry there's a gap there?
Well, fortunately, the world as a whole is educating more engineers and more scientists. And so the total IQ that's going into curing cancer, creating new ways of generating electricity without emitting CO2, and coming up with vaccines for all these diseases, we are getting more and more people participating. And the very tools of the digital revolution, the ability to share things on the internet and search large amounts of data, those tools are absolutely phenomenal. So, looking at genetic data and understanding, okay, why are some people predisposed to this and what goes on during these diseases, the research agenda of our foundation couldn't be anywhere near as ambitious without the digital revolution and the huge funding for the NIH that has built up that level of scientific knowledge. And so, yeah, there's certainly a lot of companies that aren't focused on the needs of the poorest. But I think that's okay. I don't think the balance is shifting away from them. In fact, when I go to Silicon Valley and I talk to the people who've been successful there, I talk about a few of those technologies like monitoring health. Yes, it'll be used for people in their exercise program, but we'll take those same kind of health watches and we'll use them for people in clinics who are actually have infectious disease in Africa.
Is this a health watch?
No. This is a $10 watch. But so even though the term trickle down, sounds bad, for a lot of these things, getting the cell phones out, getting these networks set up, we are able to see huge benefits from that revolution. And that's another thing when you have this glum mood that people are in, they don't see that innovation is actually moving faster today than ever before, both here in the US on things like how we educate kids and on these global health issues.
There's a little bit of a Fitbit craze in DC. How do you feel about Fitbit?
It's a first generation of devices where, the Apple Watch is a second generation, where eventually this ability to see how am I sleeping, is there anything going on with my heart rate or my calories that are of concern, we'll be able to track our health far, far better. And it'll be very easy. You can have contests with your friends. So it's the beginning of a phenomenon that's very positive.
Now, I want to ask, we haven't talked about another one of your campaigns today, which is your giving pledge with Warren Buffett. We talked a little bit about how hard it is to sell Congress and the American people on foreign aid. Is it harder to do that than it is to sell billionaires on the idea that they should give all their money away?
Well, we're not saying to give it all away.
So that's the key part of the selling point.
They get to keep enough to do fairly well. And now the Giving Pledge is a group that's come together to learn from each other, who have been very, very lucky with their success and are committing to give the majority of their wealth away. And we have an increasing membership. We're at 127 right now, and I think we'll get more and more people joining. I think the idea of giving smarter, giving earlier, giving even more generously, I do think that's catching on. And the U.S. is the envy of the world in this area. And so I was in India last week at a philanthropy forum, getting a lot of the successful people there talking about, yes, even though the government is pervasive and the government mistakes in that case are even more troubling, the idea of philanthropists doing pilot programs, showing the government how things can be done, whether it's sanitation or education or health, they're seeing the importance of philanthropy in America and thinking that they want to develop that, strengthen it and develop that same tradition. So philanthropy is absolutely on the rise. Whether it's the tech sector, the finance sector, we have a lot of leaders that are coming in and helping us recruit more people. And the idea of how you be smart about philanthropy, it's kind of a world of its own. Doesn't have the same feedback of profit and loss. So I'll spend tomorrow up in New York City. The whole afternoon is getting a bunch of philanthropists together and talking about measurement. How does it work? How much can you expect out of a well-done measurement system?
I imagine it's a pretty competitive group.
Well, when you get into philanthropy, you're not quite competing the same way as you were when you were in the private sector.
You've won. So while we're on giving, all politics is local, and in an interview with Rolling Stone, you said, I don't give a lot of political contributions. Why not?
Well, if somebody gives $1 million on one side and somebody else gives $1 million on the other side, that's $2 million that could have gone to, a great charter school or inventing new vaccines or rolling things out. So, I don't, I just don't choose to, pour money into that type of vehicle. I do normal kind of contributions, particularly for people who are going over to Africa and help highlighting global health. And that's tended to be pretty bipartisan in nature because of the coalition there exists, fortunately, around these global health issues. But I don't think my backing, putting a lot of money into political contributions is a way I'm going to try and help improve the world.
So the super PACs can back off?
Well, they know not to call me. I mean, no, they really, no, they don't bother me because, once you set the precedent that that's not your game, they they go elsewhere.
Although you have been supporting several causes that have increasingly become political lightning rods this year, whether it's your support for education reform and Common Core or gun control initiatives, for example. Do you see increasing polarization on those issues? Those are issues that you personally care a lot about, even if you're not engaging in traditional kind of campaign contributions.
Well, Common Core is, to me, a very basic idea that kids should be taught what they're going to be tested on, and that we should have great curriculum material. Before Common Core, what existed, where 50 states were all different and many of them weren't teaching kids what you were going to end up being tested on, it was such a cacophony, and it was so low quality compared to other countries, particularly the Asian countries. We had our math textbooks were twice the size of Asian textbooks. So kids are carrying around this heavy thing, and you want to be intimidated by math? Just give the kid a super big textbook. The Asians have these nice thin textbooks, and they really concentrate on teaching the concepts. And what are the results? Well, they spend far, far less money and get far, far better results. So Common Core I would have thought of as more of a technocratic issue, the basic idea of should we share an electrical plug across the country? Well, you can get partisan about that, I suppose. Should Georgia have a different railroad width than everybody else? Should they teach multiplication in a different way? Oh, that's brilliant. Who came up with that idea? Common Core, the idea that what you should know at various grades, that should be well structured, and you should really insist on kids knowing something so you can build on that. I did not expect that to become a big political issue. Fortunately, it's moving ahead, but there's been a lot of misinformation about what it is, and that the federal government wrote this thing or something like that. So you never know what's going to become political.
I think we have a question over here. Sir?
Yeah, John Wetmore with pedestrians.org. What's the role of civic leadership and local NGOs in health in West Africa?
Well, NGOs are absolutely fundamental in these countries. In a lot of cases where the government hasn't been able to invest in some of these cases because of civil war, a lot of the NGOs, including some of the Catholic-related ones, philanthropists who've come in and funded groups there, have a lot of the capacity that exists comes from those NGOs. Now, over time, you'd like to reduce the dependency on NGOs. If you look at Ethiopia and Rwanda, as they put money into the government system, they got the NGOs to be very aligned. So they've got one supply chain system, one measurement system, and so in fact, the NGOs are still there, but it's all part of one very coordinated system. In these countries, there was no overarching system, and so the hospitals that existed, the primary care centers, were mostly NGO related. As we stitch it back together, you do want to have one overall system, but anybody who through their church or some other way gives to those NGOs, they should feel great about the basic capability that put in place. Even in Nigeria, where we do see good health care, it's often the model of the NGO that allowed it to work as well as it does.
They're going to come to the front row next, but while you're figuring out your question, in a 1994 interview, you said, they asked if, does privilege corrupt? And you said, it's easy to get spoiled by things that alienate you from what's important. How do you personally avoid that? Well,
if success corrupts, I'm probably pretty corrupted by now. I probably can't even recognize that. Our foundation tries to stay grounded by picking goals like childhood death, childhood nutrition, kids who get a 4-year degree that's a high-quality degree. We try to ground ourselves by working on problems like that and seeing, how tough it is. We try and get out in the field a lot and see where things are falling short of what, we hoped would come together, hear from teachers about education, sit down with students. I'll get to do some of that later this week. So, you know, I am very spoiled in terms of the types, interesting problems I get to work on and who I get to learn from. You know, so I try and give back a little bit because it is so much fun to work on these problems.
One of the ways that you stay grounded is talking to young entrepreneurs. What do you look for, and everybody wants to pitch you, what do you look for in a young entrepreneur, a young business plan, a pitch? Well, most pitches are about a product that's essentially already been done. The idea of finding something that's hasn't been done, that's what's tough. And so either a breakthrough in understanding behavior, a breakthrough in understanding something that can be solved scientifically because computation has gotten so much more powerful. A lot of things weren't done in the past because computers were too slow and too expensive. And now the sky's the limit. You know, literally the idea of the computer being able to see what's going on, being able to understand speech, being able to take massive amounts of data and process that, the possibilities are quite incredible. And so the startups you'd want to see today are people who have really identified what can be done now that hasn't been done yet, and how are they going to maneuver quickly enough that the incumbents who have the benefit of scale and brand and field presence and all that aren't going to go and capture that opportunity. A lot of innovation, like most, is actually done once companies are founded. The most vaunted form is, oh, I'm starting a new company. And that's great. You know, it has this kind of mythic thing, and it's a very important element. But it's once the company gets going and is doing V2, V3, building up a large R&D team, actually even more of the advance comes through that piece. And so the entrepreneur who can carry through, bring in other talents as things scale up, that actually is often more scarce than even the good idea.
I think, yeah, we have time for just one or two more quick ones. So.
Go ahead.
Joe Moore, avid playbook reader and PC fan. Two things. Can you comment on the importance of the primary point of care data that the Gates Foundation is working on, and with your programs in particular? And second of all, it's no secret that your foundation is changing the world of philanthropy. It's moving the needle in a way that we haven't seen before. How do you engage the next generation of Americans to really care and to move into that? Like, you have a whole room full of people who could go and change that. How is your foundation really doing that?
Well, philanthropy is about emotional connection. You know, taking your caring about the world and what your impact on it, and finding something that you really care a lot about. And so you can't really orchestrate what it is that people find. You can make sure they get lots of exposure, that in their own community they're seeing the social service organizations, and that they're kind of traveling the world and not just seeing the tourist part of it. You know, I'm sure people find it a little confusing in terms of what should be picked. I did. Eventually, you really just have to pick, and you might not pick, you know, the most important thing, but then you're gonna get expertise. You're gonna develop metrics around it. You may, depending on the scale, build up staff or pick partners that you want to go after with it. And so, you know, then you have no choice. So, like, our commitment to infectious disease is that, you know, Melinda and I during our lifetime want to see that largely ended as a problem. And so we're going to stick to that as the primary cause. In terms of data, you know, what's missing is surprisingly basic. Do all the kids get vaccinated? Of the kids that are dying, were samples taken so you can find out, okay, is there something new going on with diarrhea or our pneumonia that hasn't been detected? Do we need a new antibiotic? Does the vaccine have to change? And this basic feedback, so are the workers doing their job? Were the supplies there for them? Were they properly trained? And did we understand the disease burden in that area? What was causing problems properly? A lot of the measurement systems have been so macro that you get the data 3 years later and it's kind of at the country level. And that doesn't help you say, oh, the workers aren't showing up in this area. What we need is literally, at worst, quarterly data that's down at the individual primary health care center and know what's going on there. And that's where cell phones, digital systems, cameras, the ability to do very inexpensive data gathering is going to enable us to see the performance of these systems. When I was in India last week with Melinda going to the primary healthcare systems, that's a place where we've done pilot rollouts of the digital tracking so that the different workers, nobody forgets who's going to remind this mother to do the vaccination. If she doesn't come, who's going to follow up and try to make sure that happens. And in India, that was falling through the cracks in a high percentage of cases. And so now these new systems at very low cost, not much complexity, should be able to raise performance. And so it's not just this huge level macro, but really it is that one center that you know what's happening or not happening.
Who is a leader in Washington who you admire?
A leader in Washington I admire. I have to.
It's not a trick.
I think on education, the president and Arne Duncan have brought a lot. The federal role in education, K through 12, isn't the central role, but by having Race to the Top and bringing visibility to what charter schools have done, how that could be expanded, taking the test data that came out of No Child Left Behind, which really it was bad news because it showed us how poorly the inner city was doing, both in absolute and compared to the suburban schools. So No Child Left Behind was an advance. Now, nobody wanted to deal with all that bad news. It was like, oh, please stop telling us all that. Can't we shut that data source off? And then this administration coming in and saying, okay, with Race to the Top, let's find some positive outliers. Let's get behind them, whether it's teacher evaluation, use of technology, in a few places getting more kids into charter schools. There has been a positive set of steps in K through 12, and that took leadership. Telling the union that, hey, some degree of change you're going to have to be open-minded to, and we've had some change.
You are apolitical. You like smart people. You recently talked to Rand Paul. What did you find interesting about Senator Rand Paul?
Well, he has a view, many of which I would disagree with in terms of global engagement. But some of his critique of the fact that we need to do better, we need to bring higher quality to those things, we need to understand what we're trying to get done. Some of these global institutions, including even some of the UN institutions, aren't as well run as we'd like them to be. Now, the question of do we engage in improving that or do we disengage, that's where you'd find pretty different point of view.
Now, at the end, as you know, we always have a little fun. We're about to get the hook here, so I will ask you, what are you reading that we should read?
I just started this Henry Kissinger book called World Order, which is really good. What is the paradigm that brings the whole world together? Do we have any shared values, or do we just have sort of a pragmatic view of how we don't have wars with each other? Anyway, I found that very enlightening. I had a call with the author of Capital in the 21st Century, Thomas Piketty, talking about his book, and some things I agreed with him, some things I disagreed with him. That's a very important set of topics. How's wealth and income changed over time? How do government systems interact with that?
He just called you?
I called him. I'm writing a book review of his book, and so having time talking with him was extremely valuable for me.
Who's the book review for?
I have a website called Gates Notes, and whenever I read books, including fiction books like Rosie Project, to nonfiction, which is most of what I read, I generally write a review.
Now, at Playbook Cocktails, you only said one thing that was met with a little skepticism. You told us you read every word of The Economist every week. You still?
I do. I've already read this week's issue. I'm feeling very, very virtuous.
Okay, so we got Henry Kissinger. What did you read for fun this summer?
Well, the Bacchetti book took a lot of time. But in terms of fun, the most fun book I've read for a long, long time, and it was this summer, is this one called The Rosie Project. And actually, the sequel called The Rosie Effect will be coming out in the U.S., I think, in about 2 or 3 months. The Rosie Effect, the Rosie Project, brilliant book. You find yourself laughing out loud. The reason I had to read it is my wife was laughing out loud so much while she read it that I thought, okay, there must be something good in there. So,
where did you go for fun this summer?
We went to Austria. My wife turned 50, and so we did a sort of Sound of Music themed event and wore lederhosen and sang various songs that you'd expect.
You know, this interview is proving, I think, the old adage, which is that there's always the good stuff in the last 5 minutes.
Okay, penultimate question. You're a big tennis player. Give us one tennis tip.
It's a full body swing. It's not just your arms.
That's right.
Core strength is key.
And last question. You eat a lot of burgers. Why are you a burger guy?
I don't know. They're very easy to eat. You can go pretty much anywhere in the world and get a decent burger. India might not be your best choice for that.
Are you cheese or no cheese?
No cheese usually.
Okay, and where do you get the best burger?
Well, I know all the local joints in Seattle, so there's one there called Dick's. But you know, the Burger King, McDonald's, those are pretty good. You can't do a lot better than that.
You know, I'm not sure what to say, except thank you very much. This has been a terrific and wide-ranging conversation, and luckily we have Mike here to make sure that it's lively. So thank you very much. I'm especially grateful to Bank of America, our partner on this, and to all of you for coming out to inaugurate this new series.
All you live streamers, thank you.
Yes, and you can come to our website at politico.com and